viewers, today we are looking at the muscles on the real cadaver and we'll look at their organization. So first of all, I'll be looking at the muscles who are present in the anterior compartment of my thigh. We are looking at the lower limb, and the lower limb which is in front of you, this is my right lower limb, and you are seeing this front of my thigh. And now let's start identification, but before going for identification, let's look at the landmarks. The landmarks are, this is my anterior superior iliac spine, and this is where is my pubic tubercle, and there we can see the knee joint, and this is the medial aspect and this is the lateral aspect of this front of the thigh. Now let's look at the organization of different muscle within this specimen. A most obvious muscle which is visible to all of us, when I'm lifting it up, this is what you're looking at, the Sartorius muscle. You can see very clearly this muscle is coming from the anterior superior iliac spine, and it goes all the way obliquely to reach to the medial side of my thigh to be attached on the upper tibia bone, and this is my Sartorius muscle. After this muscle, what is underneath, and that is, I like to lift up this muscle, and this is my Rectus Femoris muscle. This is a straight muscle, and this Rectus Femoris muscle belongs to a group of muscles which are known as the quadriceps, and these are 4 muscles. So you're looking at this Rectus Femoris, and this is going down close to my patella. It becomes part of this quadricep tendon, and which encloses this patella, and later it becomes the patellar ligament, and proximally it crosses my hip joint, and this muscle is primarily an extensor of my knee joint, but it also brings little bit flexion at my hip joint, and this muscle is innervated by femoral nerve like its other fellows, all the quadriceps. So after isolating this muscle, now what we can see, the muscle who's present medial to this, that is my Vastus medialis muscle. This is coming from my femur, and that is becoming part of this quadricep tendon. Under this muscle, what we can see here, that is my Vastus intermedius muscle. And then the lateral component, what are we looking at? We are looking at here the Vastus lateralis. Let me say it again, Vastus lateralis, Vastus medialis, and there you can see in between is my Vastus intermedius, and this is the Rectus femoris. So my Vastus medialis, intermedius, lateralis and Rectus femoris, they all go, when they are attached distally, they becomes quadricep tendon, and this tendon encloses this patella, and through the patella it becomes a patellar ligament which is going to be attached onto a tuberosity which is located at my front part of my proximal tibia. And these muscles are the main muscle groups, and primarily their job is bringing extension at the knee joint, and all of them are innervated by femoral nerve which is coming from my lumbar plexus. Now this view clearly is showing my Vastus lateralis. This fibrous band is a condensation thickening of my deep fascia of the thigh, and this thickened band is called Iliotible Trap, and then it goes and it's placed laterally to my knee joint, and it is one of the lateral stabilizing factor of my knee when someone is standing.